Good evening, friends. My name is Dr. Santosh Waigankar. I am a consultant Uro-Oncologist and Robotic surgeon at Kokilaben Dhirubhai Ambani Hospital. Today, I am here in front of you on the occasion of Prostate Health Awareness Month, and I am here to discuss certain important points about prostate cancers. In my talk, I will be talking about what exactly is prostate, what are the diseases which affect the prostate, and I will be focusing mainly on prostate cancers. And at the end of the talk, I will be addressing frequently asked questions which I encounter or which are asked to be by my patients during my consultation. So, what is prostate? Prostate is a pear-shaped gland, as you can see, situated between the bladder and the urine tube, that is the urethra. The common prostate disease are prostatitis, which is inflammation or infection of the prostate enlargement, which is nothing but increase in the size of prostate, which is a normal aging process. Some of the people are affected by that, some are not. And last but not the least is the prostate cancer. Let us focus on prostate cancer now. What are the causes of prostate cancer? We are not aware at the moment what the causes of prostate cancer is, but there are many theories that are floating around that will cause prostate cancer. One of the most important aspects which I want to mention here is obesity. Diet can be a contributory factor towards prostate cancer, and also hereditary factors, like if your father or if your uncle has got prostate cancer, there is a highly likely chance that you may have prostate cancer in the future as well. Along with this, I'll be talking about symptoms, diagnosis, and treatment. So as I mentioned, the causes, the most important is the hereditary causes of prostate cancer, which has to be looked into because there are many investigations that are available which will help us to predict whether you can develop a prostate cancer or no. So what are the causes? What are the symptoms? Symptoms are difficulty in urinating, frequent urination overnight, burning sensation when urinating, blood in urine or blood in the semen, and chronic pain in the back, hips, and pelvis. Overall, the patient presents with urine symptoms which do not subside to medical treatment. It has been present for a long period of time and it is also distressing to the patient. Patients sometimes present with advanced cases of prostate cancer in the form of is not able to pass urine at all, or there is back pain because the prostate cancer has spread to the bones, or there might be blood in urine or there may be blood in semen, which are one of the unusual presentations of prostate cancer. Let's look at how do you diagnose a prostate cancer. The most important is PSA level. Now this is a blood test which is very simple, which is done at any pathology department, and it helps us to know whether you've got prostate cancer or no. The usual cutoff taken is 4 nanogram per ml, but it has been found that even patients who have got smaller, lesser PSA level than this may also have a prostate cancer. But roughly around 4 nanogram per ml is something which we consider as a cutoff to consider the possibility of the patient having prostate cancer. Now, what are the type of prostate cancer? The type of prostate cancer is found out by truss-guided biopsy. Now, what happens in truss-guided biopsy? In that, probe is pushed through your back passage, and under ultrasound, the prostate is visualized, and needles are put and biopsies are taken. This is an outpatient procedure where the patient comes and goes home the same day. It doesn't need admission. There is no pain, and it can be safely done. But this is the most important modality of diagnosing prostate cancer because we are taking tissues out of the prostate to look at what sort of a cancer it is, what is the aggressiveness of the cancer, and the information that we get from it helps us to stage the cancer and decide further treatment. Now to talk about the spread of cancer, whether the cancer is situated in the prostate itself or it has gone outside the prostate or spread over the body, can be found out by 4 ways. One is by rectal examination, in which your urologist or your oncologist will push a finger up your back passage and feel for the prostate. The consistency of the prostate, if it is hard, gives us an indication that the prostate has gone beyond, the cancer has gone beyond the prostate. Another most important modality is multi-parametric MRI of the prostate, which looks specifically at the prostate, and there are various phases in it which helps us to delineate different causes of lesions in the prostate, and helps us to understand whether this lesion which is found in the prostate is cancer or no. This test is specifically done for prostate cancer, so you don't have a general MRI pelvis done for prostate. In fact, a multi-parametric MRI would be a better choice to look at the spread of prostate cancer in local areas. Bone scan, as the name suggests, we scan the entire bones of the body. It's a specialized investigation in which we see at the spread of prostate cancer to various bones, and that will help us decide whether this cancer can be operated or cannot be operated. One of the newer modalities that has been there in Mumbai for a long time is the PSMA PET CT scan. PSMA is prostate specific membrane antigen. This is an antigen which is specifically to prostate tissue. So in other words, if the prostate spreads to other part of the body, wherever the prostate cells are, this antigen will go and stick to the prostate cells, and this will lit up on the PET scan. So this is a specialized type of PET scan in which a PSMA is used to look at areas where specifically prostate cells, whether they are normal or they're cancerous, have gone. Now, staging of the cancer, as I said, we'll come to know one by the biopsy, which tells us the type of cancer, and two by the spread of cancer, which is indicated by the modalities which I just mentioned. One is digital examination, multi-parametric MRI, bone scan, and PSMA PET CT. Now, if you look at this figure, stage 1 is the cancer which is localized to the prostate. Stage 2 is cancer which is spread to both the lobes of the prostate, both the areas of the prostate. More or less, the entire prostate is filled with cancer, but has not gone out of the prostate. Stage 3, the cancer has gone out of the prostate. It can go to the seminal vesicles, which are behind the prostate, or it has gone to the bladder. And stage 4 is the stage where the prostate cancer have gone all over the body. It can go to the bones, it can go to the lungs, it can go to the liver, as well as to the brain. Most important is treatment. Now, treatment for a prostate cancer depends on three things. One is the stage of the cancer, which is very, very important. Second is the age of the cancer, and third is the physical fitness. All the modalities of treatment will have some wear and tear on the body. So, whether you are old enough or good enough to be able to withstand that treatment, or even if you're old, whether you're physically fit to withstand that treatment, that determines what sort of a treatment we'll be giving you for your stage of prostate cancer. So what are the options which are available? The first option is active surveillance, second is surgery, third is radiotherapy, fourth is chemotherapy, and fifth is hormonal therapy. So let us look at one by one. What is active surveillance? It's like surveillance of a prostate cancer patient done actively. That means the patient contributes actively to this modality of treatment. Now, these are done usually in early stage of prostate cancer, where the patient is given an option of prostate surgery, but he doesn't opt for it. But he says but this entitles that the patient follows up with us regularly. It involves regular measurement of the PSA, and if the PSA goes up or the level goes up, then it might also entail periodic biopsies of the patient. So this is a sort of a modality where patient should be properly compliant, should be able to follow up on time and not forget or miss his follow-up, or the consequence would be that doctor won't see him and the cancer might spread and go unnoticed. Surgery in prostate cancer is called radical prostatectomy, in which we take out the prostate and the surrounding tissues, and the bladder is attached to the urethra. How it is done? It is done in the form of an open method, laparoscopic method, or a robotic method. Now, what is radical prostatectomy? As I mentioned, this small globe here of the prostate is taken out, and this urine tube is attached to the bladder. How it is done? Now, in case of open, you can see a big incision is given, and this entails the patient to stay in the hospital for a longer amount of time. It also probably causes some amount of pain and some amount of blood loss as compared to other modalities. But the general principle underlying the surgery in all three modalities are more or less the same. In laparoscopy, as you can see, the surgeon stands on the side of the patient, and there are 4 to 5 to 6 holes that are made in the body, which are 1 centimeter holes, 0.5 to 1 centimeter holes, and then the instruments are placed inside and the surgery is performed. This is called as a minimally invasive approach to doing prostate surgery or radical prostatectomy. The advanced, here you can see the ports that are placed for laparoscopic surgery. The small tiny hole vis-a-vis the long incision which you take in open cases. Now if you see the robotic surgery, same ports are used, but if you see, this is the console where the surgeon sits and he controls the robot, and this is the assistant which is there as a bedside assistant who helps to assist the surgery, and this is the vision card through which the assistant can see the surgery. The surgeon sees it in the console. So overall, I want to put across this message that robotic surgery doesn't mean that the patient and the robot are left in the operation theatre and the operation theatre is locked and the robot does the surgery. It's not so. The robot does the surgery and it is controlled by the surgeon. So in fact, the surgeon is doing the surgery, not the robot. Another modality of treatment usually offered for patients who don't want to undergo surgery or those who are not fit enough to undergo surgery is called as light therapy in common layman language, or radiotherapy, in which radiation is directed towards the prostate and the prostate cancer cells are burned. There are various ways of giving radiotherapy in which the damage to the surrounding tissue is less and the radiation is focused only on the prostate cancer and nowhere else. Other modality is it's a hormonal therapy or chemotherapy. Now, as you know, is hormone for a prostate is testosterone. In other words, testosterone, the food of prostate is testosterone. So testosterone helps in the growth of prostate. Needless to say, it will also help in the growth of prostate cancer cells. Hence, what I mean by hormonal therapy is we deprive the prostate cancer of this testosterone supply, eventually the cells die. Now, this hormonal therapy can be given in addition to the primary therapy, which can either be surgery or it can either be radiotherapy, or it can be given as only treatment modality if the patient is in stage 4 prostate cancer. That is what I meant by it has metastasized, or in other words, spread to other areas of the body. Chemotherapy is also one of the modalities which is offered to patients of prostate cancer depending on the stage and depending on their physical fitness. In the end, I want to end this talk now that you know that prostate treatment is not limited to only one individual. It is a multi-specialty effort. It's a team involved who includes urologist, uro-oncologist, medical oncologist, nuclear medicines who diagnose the disease by doing PSA and PET-CT, radiologist who do MRI, MP MRI or multiparametric MRI. Then you have radiation oncologist who give radiation. You have nurses who take care of you either as operation theatre nurses or nurses who are there throughout your recovery after the surgery. Physiotherapy and psychologists are also a part of this team. Not to forget the pathologists who help us to understand the disease better, because once we take out the prostate, it is sent to the pathologist who looks at the prostate as a whole, cuts it into pieces, looks under the microscope and lets us to know give us some more information which will help us to plan your treatment after the primary therapy. Most important here is that the physiotherapy is important because most of the commonest sequelae of a radical prostate is you're not able to pass urine. You don't have control over your urine over the first 3 or 6 months. That is where we teach you special exercises which you can do to gain that control early, and this is done by a physiotherapist who will help you understand and teach you these exercises. So it's a team effort, not only me doing the surgery, but overall, and last but not the least, you as a patient and your willpower to overcome this disease and to face this modality of treatment or any modality of treatment besides surgery and to recover from it. Now let us talk about the frequently asked questions which are usually asked during consultation, after surgery, before surgery. Now, one of the most common questions is, am I more likely to get prostate cancer if my father had it? Yes, you are likely to get prostate cancer, and there are genetic tests available in Mumbai which will help us understand your chances of getting prostate cancer, and accordingly we formulate a treatment plan for you. So people or men who have history of their fathers or their uncles or their brothers having prostate cancer should voluntarily come up and get themselves evaluated and know their risk of chances of getting prostate cancer. Is there anything I can do to prevent getting prostate cancer? Well, to be frank, and no one knows how to prevent prostate cancer, but staying a healthy weight may be important. Being overweight may increase your risk of being diagnosed with aggressive or advanced prostate cancer. Other than that, there is nothing much you can prevent it, and there are no medications available which can prevent you getting prostate cancer. Does red wine help to prevent prostate cancer? This was one of the questions asked to me by my patient. Well, red wine, although some studies suggest that it may help to lower a man's risk of prostate cancer, there are no studies have been definitively conclusive in telling us that it is effective in reducing the risk of prostate cancer. Does vitamin E and selenium protect us against prostate cancer? No, this is a misnomer. How can we know if prostate cancer will grow rapidly or no? You cannot know. But as I said, by staging, we get a fair enough idea out of experience, and there are many studies available which help us guide you and help us understand whether your prostate cancer will grow rapidly or no. That is one. After surgery, when the specimen of the prostate is sent for histopathology, the final report that we get from the pathologist also help us understand and probably predict and tell you how aggressive your prostate cancer would be. According to that, we will devise your follow-up plan, and that will help us to keep a check over your disease and yourself even after you undergo primary therapy, whether it is in form of surgery or it is in form of radiation. So how do we follow up the patient? We do periodic PSA levels. PSA level will fall after your primary therapy, but once it starts rising, and it has got an algorithm, once it fits into the definition of a significant rise of PSA, that's where we come in, we investigate what the problem is, and we treat you accordingly. What is prostate cancer screening? Now, screening is to look at a person. So, prostate cancer screening is a concept where men over a specific period of a specific age are checked or evaluated whether they are having prostate cancer. They may not be having symptoms. Now, one of the commonest way to diagnose prostate cancer in Mumbai is, or anywhere in the world, is by doing medical checkups. So you see, medical checkups usually have the option of doing PSA screening, or they are a part of their battery of tests that they do in medical checkup. And that's where many of the patients are picked up with early cancer. And these are the patients where we offer them either surgery or active surveillance or radiation. in screening, what we do, we ask patients, especially over the age of maybe 40, 45, who are suffering from urine problem, and that urine problem is not solved or not treated by taking medicines. The quality of life is affected, or they have a family history or of prostate cancer. These are the people who undergo prostate cancer screening to detect early cancers. But it is important to know that it is a shared decision between the patient and the surgeon of doing prostate screening, because once, unfortunately, or if you are diagnosed with prostate cancer, then you should be able to take a decision of, you should be ready to go ahead with what the treatment that is available for that particular stage of prostate cancer. Is prostate cancer curable? Early stage, they even say that patients' chances of living a long life are almost 100% in early cases. As the stage goes on, the survival period decreases. But overall, let me tell you that prostate cancer is an indolent cancer. That is, what I mean by that is, it grows very slowly, and the chances of a patient diagnosed with prostate cancer to die because of prostate cancer is very less as compared to his possibility or his chance of dying because of a heart attack. So that indolent is a prostate cancer. When should I start testing for prostate? As I said, whenever you feel that you are having urine problem and it is not getting sorted out by taking medicine, it has been there for a long period of time, and routinely this sort of a question doesn't arise because most of you are health conscious and do health checkups periodically. Most of them do it annually, and PSA is always a part of those health checkups. So this question should not arise because that automatically gets done with. But those who are not doing regular health checkups, but they are having urine problems which are been long standing, or they have a family history, I would urge that their treating physicians to urge these people, the family physician to urge these men to come up and get themselves tested for prostate cancer. What are the potential side effects of prostate cancer treatment? It depends on what sort of treatment you're taking. If you're undergoing a radical prostatectomy, then there are many. One is, these are not side effects, these are sequelae. One is urine control is not there for the first 3 to 6 months, but if you do proper exercises, then it can come back within 1 month as well. Erections is something which patients do have a problem. They don't get their usual erections back, but over a period of time, some percentage people do get it, but we cannot 100% vouch either a particular person, because our main concern is to have cancer control over anything else. Third is regarding radiation. Sometimes radiation does cause radiation cystitis where your urine issue might aggravate. That is one thing in radiation. And last but not the least are side effects of hormonal therapy. Because hormonal therapy, it can have some effects on your heart, it can have some effects on your blood, but since these therapies are monitored well, and if you keep yourself on proper follow-up as suggested by your surgeon, I don't think this will be much of a cause of worry for those who are undergoing this sort of a therapy. This question I've already answered. What is active surveillance? It is active participation of not only the surgeon but also the patient in undergoing surveillance and to see if the diagnosed prostate cancer is increasing or the stage is going or the PSA is rising. So these are the people who are already been diagnosed, but they have not opted for either radiation or surgery, but they want to be kept on follow-up, and the only way of follow-upping is doing a PSA at regular intervals. How likely is my cancer to progress without treatment? Well, oncologists who treat prostate cancer take a number of factors into consideration that predict how fast the cancer will grow. One of the things, as I mentioned, is the stage. The stage when you have been diagnosed of prostate cancer, and the stage when you undergo a prostate cancer surgery and that specimen is been analyzed and the final report is given to you. All these factors will decide how quickly it is going to progress or how slowly it is going to progress. But it changes or differs from individual to individual. It is not the same for all the patients. What should you do if you or someone you love has just been diagnosed with prostate cancer? Well, first, you need to support them and tell them that this is a very indolent cancer. It doesn't grow fast as compared to lung cancer or intestinal cancer or breast cancer. It doesn't grow fast, but it can be controlled if it is diagnosed early and if you are keeping follow-up. And if you subject yourself to the right modality at the right time at the right place, then you will be able to lead a good life, a good quality of life, even after being diagnosed with prostate cancer. With this, I end my talk, my friends. I hope I was able to cover specifics about prostate cancer. If you are diagnosed with prostate cancer, you need to get yourself treated at the right place, by the right person, at the right time, and you will lead a very good life. Thank you very much. I'll be looking forward to your comments and your queries.